Uncontrolled asthma can lead to ER visits, lalo na pag hindi kontrolado ang symptoms, hindi regular na gumagamit ng gamot ang isang pasyente.
Hello everybody, it's me, Samantha Purvor, and welcome to Let's Talk Wellness with Watsons. Napaka-unpredictable ng weather lately. Minsan maulan at malamig, next day biglang maaraw at mainit. And apparently, these weather changes are not the best for those who have asthma. Kaya naman we invited a very special guest today to discuss kung paano naaapektuhan ng panahon ang asthma. Of course, before we get into that, follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel for more health tips. Our guest doctor for today is Dr. Janeth Samson, a doctor of internal and pulmonary medicine. Welcome to the show, Doc.
Hello Sam, hello everyone.
Doc, napansin ko lately, napaka-erratic ng weather, and I understand that these frequent weather changes can really affect people with asthma. Bakit nga ba ganun?
Ang pagbabago ng panahon ay actually nagkukos ng epekto sa taong may asthma, lalo na kung hindi ito kontrolado at hindi ito regular na gumagamit ng gamot. Ang malamig na hangin ay nagkukos ng irritation ng airways as well as pangingipot ng daanan ng hangin. Ang mainit na hangin naman ay nagkukos ng molds or amag or smog that can cause triggers.
Doc, tama ba na mas kailangan natin mag-ingat during rainy season if we have asthma?
Actually, ang pag-uulan ay nagkukos ng pagsabog ng mga pollens, molds. At the same time, pag-increase ng respiratory infection sa mga tao. Lahat ng ito ay nagtitrigger ng asthma.
So Doc, how can asthma affect our daily activities?
Sa asthma, may pangingipot ng daanan ng hangin, may pamamaga sa daanan ng hangin din, at may pagtaas ng plema sa ating baga. Lahat ng ito ay nababawasan ang flow ng oxygen. So naglilimit ito ng ating exercise at ating mga activities.
So Doc, what about our sleep patterns? Naapektuhan rin ba ito ng asthma?
Oo naman. Pag tayo natutulog, most of the attacks are usually at night because there are certain levels in our hormones that are lowest at night. And this causes pamamaga ng daanan ng hangin as well as mga pangingipot ng daanan ng hangin.
And Doc, what are the common age groups that are most at risk of asthma complications?
Asthma can affect any age group, but most commonly during childhood.
And Doc, is it true that having asthma can actually lead to more frequent visits to the emergency room?
Yes, Sam, uncontrolled asthma can lead to ER visits, lalo na pag hindi kontrolado ang symptoms, hindi regular na gumagamit ng gamot ang isang pasyente, hindi regular din ang kanyang check-up.
Dahil nga may effect ang asthma sa everyday life natin, does it actually affect our quality of life too?
Yes, uncontrolled asthma, so limitado yung kaya ng pasyente. Limitado sa sports, sa kanyang trabaho, parating absent, sa school or sa work.
So Doc, can asthma significantly also affect our mental health?
Yes, because of the limited activities that an asthmatic patient can do, it increases the anxiety level of each patient. And this in turn increases the stress and likewise can trigger asthma.
Napansin ko lang na minsan parang ang daling mapagkamalang asthma ang allergy symptoms. Can you tell us the main difference between the two?
Allergies are immune system's response to common substances like pollens and molds. It can be mild or severe. Asthma, on the other hand, is characterized by wheezing, shortness of breath, chronic cough, and these are all because of the airway narrowing and airway inflammation. Kaya importante na tayo kumonsulta sa ating doktor para malaman natin kung ito'y asthma or allergy lamang.
Wow, Doc, thank you for clearly explaining the differences between asthma and allergies. But now for individuals naman na may heart conditions, I do understand that COPD or chronic obstructive pulmonary disease is very common and that may mga overlap rin to with asthma. Can you explain the difference between them?
COPD is primarily caused by long-term damage to the airways as well as lung tissue brought about by exposure to smoking or biomass fuel. And this causes irreversible airway obstruction or pangingipot ng daanan ng hangin. Para mapaghiwalay yung dalawa, kailangan natin ng isang test kagaya ng lung function test para malaman kung ito'y just asthma or COPD.
Doc, since we already know that the weather really does have an effect on asthma, meron ka bang mga tips about managing asthma during the dry, the wet, and also colder seasons?
Ang importante kasi, you have to be compliant with your medications in order to achieve good asthma control. If you have good asthma control, your lungs are less sensitive to triggers, good inhaler technique, regular checkup with your doctors, and regular exercise. It also increases our lung function.
And Doc, how about nebulizers? Gaano ba ito ka-importante?
Nebulizers and inhalers are devices that are used to deliver the medications into the lungs. And for severe attacks, we usually use nebulizers because these patients may not be able to do good inhaler technique. Pero pareho lamang ang efficiency ng dalawa in terms of delivery of medications pag hindi naman severe yung attack.
Doc, thank you so much for explaining the effects of weather on asthma. Now, before we actually wrap up our day, do you have any last-minute reminders for all of us?
Importante lamang na i-remind natin ang ating mga pasyenteng may asthma na gamitin ang kanilang gamot regularly, mag-check up sa kanilang mga doktor regularly as well, and avoid their triggers. Avoid smoking, avoid vaping, do exercise regularly in order to increase lung function.
Well said, Doc, and thank you so much for joining us here for today.
Thank you, Sam, for inviting me.
Learning to manage our asthma as our environment and personal needs evolve is very important. And now, to help us remember Doc Janeth's tips earlier, we invited one of our Watson's pharmacists we have with us, Diane Renlin Lopez. Welcome to the show, Diane.
Hello, Sam. Hello, everyone.
Para sa'yo, Diane, as a Watson's pharmacist, what's your main takeaway sa discussion namin kanina ni Doc Janeth?
Napaka-relevant ng discussion ni Doc Janeth. Importante na alam natin ang differences ng asthma and allergies as well as yung asthma triggers and treatment. As a Watson's pharmacist, essential ito para makapagbigay ako ng proper advices or counseling para sa customers.
Siyempre, sobrang agree ako with you, Diane. Now, para mas matandaan pa natin yung mga reminders ni Doc Janeth kanina, we're going to play How's the Weather Asthma and Allergy Edition. So, ang gagawin ko, magbibigay ako ng short weather forecast and you will be telling us what we can do to manage either asthma or allergies under those particular conditions. Are you ready, Diane?
Yes, game.
Let's start off with sunny with a chance of high humidity.
Hot weather and high humidity can be challenging if you have asthma or allergies. In those conditions, it is good to stay hydrated, wear light clothing, stay in a cool place, and keep emergency medications nearby.
Cold with very low humidity.
Extreme cold weather with dry air can dry out our airways, which can trigger asthma attacks and allergy flare-ups. If you can, invest in a humidifier and always keep your emergency medicines within reach.
Thunderstorms with high humidity.
When it's rainy and very humid, we tend to stay indoors, raising the risk of contracting flu or pneumonia, which is bad for asthma. In this condition, invest in a dehumidifier or stay in a humidity-controlled area. Again, have your emergency medicines nearby, and it would be good to get your flu vaccine and talk to your doctor about your pneumonia vaccine too.
That was amazing, Diane, and thank you so much for being with us here today.
Thank you, Sam, for inviting me.
Asthma and allergy care requires constant adjustments to our routines. And to help empower you to learn to navigate asthma, Watson's offers a comprehensive range of medicines, health and fitness equipment, vaccines, and other wellness essentials and services over at the Watson's app and at our 1,100 plus stores nationwide.
For more information about medicines, supplements, and health equipment, don't hesitate to ask your Watson's pharmacist.
Aside from knowing your triggers and getting regular checkups with your doctor, it's important to have the right essentials at home to help with your asthma or allergies. Alerta contains loratadine, which gives you non-drowsy allergy relief that acts fast. Get Well Ultrasonic Portable Nebulizer is lightweight, low noise, easy to clean, easy to operate, and features fast medicine delivery. Alnix Syrup Contains cetirizine that provides quick relief for allergic rhinitis. It's non-drowsy and less likely to cause dizziness too. Omron Compressor Nebulizer is an efficient nebulizer that combines fast treatment time with the ease of use, ideal for frequent nebulizations done at home. Allerkid Cetirizine is an anti-allergy medicine for kids that helps with sneezing, itchy eyes, and nose, as well as other allergy symptoms. Comp Air Compressor Nebulizer is a highly efficient nebulizer that helps manage asthma, chronic bronchitis, and other respiratory issues. It's silent and comfortable for daily use. Benadryl Syrup helps relieve coughing and minor throat irritation associated with colds and allergies. Get your asthma and allergy essentials through the Watsons app or at 1,100 plus stores nationwide. I'm Samantha Purvor, inviting you once again to empower your health with love.